Dr. George Giorgio. He's been on the show so often, we're thinking of naming the show after him. He brings some great stuff to us. If you remember, the first time he did the Candida lecture, which was really excellent, he backed that up with the heavy metal lecture, which if you haven't watched those two, they are still in the VIP app. Make sure you check those out. And today he's taking us to a whole other place, energy medicine and bioresonance. So without any further ado, I'm going to turn it over to my co-host, Bill Walcott, and then we'll get started. Bill?
Thanks, Al. Welcome, Dr. George. Welcome back. And I have to tell you, out of the presentations you've made, this to me is the most exciting one, so I can hardly wait to hear what you have to say. And I think we can call this a vision of possibilities of the future, and the future is now. So with that, I think I'll just turn it over to you and let you tell us all about this really interesting subject. Take it away.
Yes, thank you, Bill. We are indeed entering 21st century medicine here. You can call it Star Trek medicine because this gives the practitioner, particularly the one that's working within a holistic model, as in metabolic typing and other modalities, to really practice holistic medicine, but to practice it objectively by being able to measure a lot of the causative factors behind a lot of the chronic diseases that we're seeing more and more often. We can start with the next slide, which is basically asking the question, what is energy? As we know, energy is all around us. It's invisible, but it is measurable. Physicists can measure it. Einstein, Max Planck got involved with energy. An interesting fact is that the Earth itself actually generates what is known as a Schumann wave that resonates at a frequency of 7.83 hertz. And that gives the body the energy and vitality that it requires. In fact, if we're not exposed to that Schumann wave, as astronauts found out when they left the ionosphere, because the Schumann wave actually stretches from planet Earth up to the ionosphere, as the astronauts were leaving the ionosphere, they were getting sicker and sicker. They were developing insomnia, anxiety, generalized anxiety disorders, depression, other neurological problems, gastrointestinal problems, and a whole mode of other symptoms. Interestingly, the heart resonates at exactly the same frequency as the Schumann wave, 7.83 hertz. Also, the brain, particularly when it's in the alpha wave modality, it also resonates at around about 7.83 hertz. Lightning also has a frequency of 7.83 hertz. So it's theorized that the lightning is actually energizing this frequency of the planet in order to energize us and keep us healthy. So it's interesting that the planet itself is actually emanating energy that we are absorbing. Of course, there's also the energy of the sun, and you know, we have a lot of researchers, such as Professor Pop, that also showed that each and every cell of the body is actually producing light. He called them biophotons, and it's postulated that these biophotons or photons are actually helping in cellular communication throughout the body. If we go to the next slide, we can see that energy is everywhere. It's in our mind, it's in our soul, it's in our body. It's when we sleep, when we laugh, when we work, when we exercise, when we pray, when we meditate. Everything we do it has an energy component to it. And in fact, we are energy beings. We are made of atoms. And the next guy who had quite a high IQ actually said if you look at the next slide, everything is energy. That was Albert Einstein and Max Planck themselves. Now, the next researcher in the next slide is a scientist, a Japanese scientist, who back in the mid-90s actually decided to see if we could measure energy and if we could actually see energy. So this is the realm of visual medicine. His name was Emoto Masuru, and what he did is he basically took sources of water and he divided the water from the same source into different bottles, and he placed words on each of these bottles. And because his laboratory was in the refrigerator where he's got his microscope, he was able to freeze this water and actually look at its crystalline structure. And what he discovered is that every time a new word was presented, there would be a different geometrical crystalline structure of this water. And interestingly, when good positive words were used, such as compassion, thank you, wisdom, you can see on the top line there's a beautiful crystalline structure. However, when bad energy words were used, such as I will kill you, you fall, and also when they played heavy metal music, you could see that the geometric structure of this crystalline water just disintegrated. Interestingly, in the two pictures on the right-hand side, we can see the water from the same source. It was actually from a polluted lake, before and after prayer. The bottom one is before, the top one is after prayer. So here we have a method of actually seeing the end result of energy, because by placing the words, of course, on the bottle, it is the intention. But also music is also energy, it's frequency. If we look at the next slide, we will see some more examples. The top slide again is before prayer, after prayer, and then we can compare the thank you slide on the left and the love and appreciation on the right with you will make me sick, I will kill you. Of course, what is the implication to health? The implication is that we're made of 70% water, if not more. So therefore, if we're surrounded by a lot of these negative energies and negative words, negative thinking, negative music, then this will have an impact on our health, and we will get sicker and sicker. So really, what I'm presenting within a holistic model is another level of health, which we also need to look at, this level of energy, because 5,000 years ago, the Chinese discovered that we do have energy traveling in channels that they called meridians. 7,000 years ago, the Indians developed Ayurvedic medicine and discovered the chakras. And we know that the chakras also absorb energy from the planet, from the sun, and channel them through the meridians. And this is of vital importance to maintaining good health, including spiritual health. The next slide is just another example of the word love and the beautiful crystalline structure that we see there with the word I hate you, and you can see a disintegration in this crystalline structure.
George, is it okay to bring a question up at this point, or would you rather wait till the end?
Go ahead. Yeah, let's have a question.
Well, I actually have two questions, but my most important one is, in the beginning when you were talking about the frequency that seems to be our brain frequency and alpha waves, our frequency that you were mentioning, you mentioned some things. Did you say that when we go into outer space, that the frequency changes, so all of a sudden we see changes in respiration rate, blood pressure, blood sugar, bone density, all those things? Did you say that?
Well, I didn't actually say that. I said that in astronauts that
That's
leave
what I
the
meant in astronauts, right?
yeah, in astronauts that leave the ionosphere, and so they get cut off from this vital Schumann wave.
Yes.
They get sick. So now, when astronauts travel, they actually have a Schumann generator, a Schumann wave generator, in the space capsule.
Yeah. Yeah.
Which is
Interestingly
producing
enough,
that 7.83 hertz, which is maintaining their vital functions and all their health at a good level.
you know, actually, I've just been reading a number of books about being in a non-gravity state, and a lot of the things that they were saying, and they might be missing the boat, especially with what you just said, that they said it was the lack of gravity that was causing those things. And now, by talking about a Schumann wave generator, it really is not what they're saying in these books, but rather the frequency that you're talking about, which is really very, very interesting, because there's a whole thing about using vibrational platforms to, when astronauts come back, to try to restore, and maybe it's the vibration and they're missing the boat on it because they thought it was gravity, where rather it's this Schumann wave.
Well, I think it's both factors, to be honest with you, Al. I think gravity will definitely lead to bone density problems. And so therefore, you know, when they come back, you know, they start exercising vigorously to regenerate that. But on the other hand, there is the other causative factor of being detached from the Schumann wave and getting sick that way as well.
Thank you. That's terrific. One last point. Some of the research that I've done on attention deficit talks about that the children with attention deficit also have a problem with this vibrational wave, that they're not in sync with that wave. Interesting. So.
Well, one of the factors that we have in our world today that upsets the Schumann frequency, and so, you know, we basically do not get the benefit of this 7.83 hertz, is all the other negative energies from mobile phones, you know, masts, high tension cables, all the electrical equipment that we have, the Wi-Fi's, the microwave ovens, etc., etc. Yeah, all of these generate negative electromagnetic fields that actually have a negative left spin on them. Negative energy is left spin energy. Positive energy is right spin energy. So all these negative electromagnetic fields, as well as geopathic stress, which is underground water lines that can also upset the very delicate electromagnetic fields of the body, all of these things actually upset the frequency of the Schumann wave. And of course, they can lead to illness as well. I think because a lot of practitioners and a lot of lay people do not understand what the phenomena of resonance is, I think it's good to explain in the next slide what do we mean by resonance. Resonance is just simply a matching of frequencies. So all living and non-living things, they have their own resonant frequency. It's like they have their own unique sound. We know the example of the opera singer, for example, that can smash a glass with her high voice, because that glass has a resonant frequency. A wine glass, a crystal wine glass, would resonate around about 500 hertz, which is 500 cycles per second. So if she can match or he can match the frequency of that wine glass, then that wine glass will absorb the energy and it will smash. And this is an example of resonance. Another example would be when we turn on our radios and we turn it to the frequency of the station that we want to tune into. There is a resonance with the base station because they're matching the frequencies that the base station is sending out. This is another example. Of course, bridges falling down, the Tahoma Bridge back in the 40s, That is an example of resonance as well. Two tune-in forks, either end of the room, say, a C fork, if we hit it, then we will see that the C fork at the other end of the room will also resonate. This is an example of matching of frequencies and resonance. In the next slide, we did have a video, but I think it's not possible to show the video in the technology that we're using. But this was actually done in a physics laboratory in an American university. They measured the resonant frequency of the glass, and then they matched that frequency with the speaker behind. They generated the frequency with a frequency generator, and lo and behold, the glass smashed. You can actually see this video on YouTube if you're interested. In the next slide, we need to now explain what is bioresonance, because this has to do with all living organisms, whether they are microbes or whether they're organ systems in the body. All of these living organisms have their own resonant frequency. So if we take a protozoan, for example, like paramecium or amoeba, they have their own resonant frequencies that differ. If we can match these resonant frequencies, we can actually destroy these in the body as we can any other microbe, including pathogenic microbes such as viruses, such as bacteria, such as fungi, and parasites. This is the phenomena of resonance. Again, it's the matching of frequencies, but we're applying this now to living microorganisms. There is, again, another slide. If we go to the next slide, we can actually see a photo of a protozoan that is being bombarded with frequencies. The resonant frequency of this protozoan, it's a paramecium, is around about 1150 hertz, and you can see that there is what a phenomena known as electroporation, where the cells actually start vibrating, and eventually they break open and you get lysing, where the internal plasma of the cell lyses out, and of course this dies. This process can actually take place in the body, and it has been proven many, many times, and we'll come to that in a few minutes, how we can use bioresonance devices. These have now become smaller and smaller, so they're portable, for helping people eradicate parasites and other microorganisms, including the herpes virus and the hepatitis virus, which are considered incurable by classical medicine as well as natural medicine. If we go to the next slide, this is probably one of the most famous. This was a video, again, you can watch it on YouTube, killing protozoan with frequencies. You can actually see these paramecium being destroyed with frequencies under the microscope. If we go to the next slide, we'll see a famous researcher who got involved with bioresonance back in the 20s. Did a lot of research. It's Dr. Royal Raymond Rife. He built huge frequency generators using a lot of the top-end electrical equipment of his time, Kennedy generators, etc. And in 1934, utilizing the universal microscope that you see him with in the photo, he could actually see living viruses, and he could have his frequency generator and see when the correct frequency was killing the virus, the mortal oscillatory rate, as he called it. And interestingly, he managed to identify viruses inside cancer cells. In adenocarcinomas, he found the BX virus. In sarcomas, he found the BY virus. And he managed, in 120 days, to cure 16 terminally ill cancer patients. This was supervised by famous doctors of the time who got together and supervised this experiment. Unfortunately, because the pharmaceutical companies were also prevalent at the time, they didn't like the idea of treating chronic diseases with electricity and frequencies, and they intervened, and unfortunately they drove this type of technology underground. They arrested Rife, they pulled him through the courts, the usual scenario of destroying perhaps one of the biggest brains of this century in medicine. The next slide takes us a few years further down the road, back in the 60s, mid-50s, 60s, where Dr. Reinhard Voll, who was an MD, began looking at the relationship between acupoints, meridians, and health. And he scientifically proved electroacupuncture as a new diagnostic and therapy method. And he intercorrelated the active acupuncture points with internal organs and tissues of the body. It was quite a complex system. You had to know all the Voll points on the body. It used to take quite a long time to diagnose a patient, but the accuracy of diagnosis and the pathogenesis of disease that you could actually identify was quite stunning. He published 500 scientific works, textbooks, manuals, etc. The next slide brought us perhaps to the third generation researcher in bioresonance, and that was Dr. Helmut Schimmel. He was both a medical doctor and a dentist. And basically what he did is he built on Voll's work, but he simplified it. He discovered that you could actually take one point, one acupoint on any of the fingers and use that acupoint alone, and utilizing various ampules. For example, you take a measurement from an acupoint, you have an ampule of, say, Staphylococcus aureus, you place it on the honeycomb that you can see on this machine, which is an outcome of his research. And if there was resonance between the Staphylococcus in the body and the Staphylococcus in the ampule, then there would be an indicator drop, because the conductivity would actually change on the acupoint. And this is the bioresonance, or the vegetative reflex testing, VRT testing, bioresonance testing, that is used by many practitioners with in excess of a 90% accuracy to be able to identify any microbe, any bacteria, any parasite, any virus. They can also go through the organ systems. They can identify which organs are imbalanced or underfunctioning or overfunctioning, either inflammation or degeneration. So it really does open up a huge area of diagnostics for the health practitioner, whether they be a medical doctor or whether they be a naturopath or a clinical nutritionist, etc. The following slide shows us an example of bioresonance therapy. Here you can see that the machines are quite large. The capabilities of these bioresonance therapy devices is that whenever an organ which has its own resonant frequency becomes ill, the resonant frequency actually drops. And you also have spikes on the sine waves, which is the normal electromagnetic wave of the body. What these machines are capable of doing is they have electronic filters that can actually filter out the normal healthy sine wave, amplify it, and give it back to the body from the pathological sine wave with all the pathological oscillatory frequencies on it, all the little spikes. It will invert that. That cancels out the pathological frequencies. Then it turns it back to normal, amplifies it, and gives it back to the body. So what we're doing with these bioresonance therapy devices is, in effect, we are cleaning up energetically the pathological oscillatory frequencies that are causing the various symptoms in the body, whether they are allergies or whether they are sinusitis or allergic rhinitis or whatever other symptoms may be present.
Is this similar to a type of interferential type of machine where it interferes with the particular frequency, and as a consequence, that interference is what blocks that bad frequency?
No, no. This works on a different principle by differentiating between the healthy oscillatory frequencies and the pathological oscillatory frequencies. It will invert the pathological frequencies, cancel out the pathology, and then reinvert it and give it back to the body. There are other, it can also give the same frequency that the healthy organ would have, because as we said, all healthy organs have their own resonant frequencies. When the organ gets sick, then that frequency actually drops. So by giving the same frequency as a healthy organ, what we are doing in effect is up-regulating that organ. We're actually increasing the transmembrane potential. We're up-regulating the metabolism of that organ and bringing it back to some form of optimal functioning.
Dr. George, if I may interject also at this point, I know that you and I share very similar or the same viewpoint in terms of a holistic model.
Yeah.
So I wonder if you might just say a word or two at this point so that our listeners do not be misled or go off on the wrong tangent. If the organ itself has a lowered frequency due to, say, heavy metal toxicity, or due to petrochemical toxicity, or due to a structural problem, for example, I don't think that you are saying that this type of an approach by itself would be sufficient. You still would need to address, or I should say, you would still need to identify, address, and remove the underlying cause if it is something other than an energetic cause.
Yes, I'm not saying that this replaces everything else that holistic practitioners practice. It is, however, a very powerful additional tool that can be used because in the 30 years that I've been practicing as a clinician, I have never been able to actually treat viruses such as herpes or hepatitis, at least using natural medicine. And none of my colleague friends who are medical doctors have done the same either. So this type of technology, however, gives us the ability to actually penetrate into that microbe world, and we all carry between 3 and 5 kilograms of microorganisms in our bodies. Sometimes they will become pathogenic, particularly when we disturb the internal milieu and the pH of the body and the friendly bacteria in the gut and so on and so forth. Of course, we can use other protocols of detoxification and bringing the pH of the body back to normal and optimizing the diet and identifying food intolerances. Of course, we can, of course, use the bioresonance diagnostic machines such as these to actually diagnose all these causative factors.
Exactly. Great.
Yes. And that really opens a huge world for a lot of the practitioners, because I often go to conferences abroad and we chit chat with practitioners, and what I'm finding is that a lot of them are using, you know, questionnaires to determine all this. The accuracy, of course, of that, you know, is dubious and subjective, etc. Whereas here, you can actually sit a patient in front of you, and the patient has got prostatitis, for example, and you're asking yourself, okay, why does this patient have an inflamed prostate? Now, could it be chlamydia? And then you put the chlamydia ampoule on there, and if they're resonating with chlamydia, because indeed they have chlamydia in their body, then you will get an indicator drop and it will say, yes, this chlamydia. And then you know that you can use bioresonance therapy to program the chlamydia frequency and treat the chlamydia, because that is an underlying problem. I've just given a very simple example. The pathogenesis of disease, of course, can get quite complex with many other causative factors that you can also measure using the bioresonance diagnostics. If we progress to the next slide, we'll see that this is another example of a bioresonance therapy device that was actually invented by Professor Morel with his son-in-law, who's an electronic engineer. And this is another big device. Now, I became quite interested recently in the Russian research because someone approached me and talked to me about the Russian research that has been done in the field of bioresonance. And I said initially, well, show me the research. The next slide is just basically asking a question about these larger devices that we've seen, you know, about their portability. They're not portable. They have to sit in the clinic. The patient has to travel to the clinic to be placed onto these. There is an expense. There's time out for the patient. It's not very convenient. So when I heard about this Russian research, what really captured my attention, apart from the fact that they've done 117 clinical trials, this is the next slide, they also had developed portable devices which the patient could actually buy. These portable devices, bioresonant therapy devices, are actually programmable. There is a set of programs on a USB stick that you can plug into the computer and actually download the frequencies for the various bugs and microbes that the practitioner has managed to identify using the bioresonance diagnostics. Another thing that astounded me when I went through the research is they have a 90% success rate with treating hepatitis, including hepatitis B and C, which can cause cirrhosis of the liver and is a serious problem worldwide. 96% success with parasites of all types, helminth families, nematode families, tapeworms. We know how difficult it is using natural medicine, classical medicine, to eradicate all of these microbes. They have a 92% success with treating Helicobacter pylori, which again is another horror story with plenty of antibiotics that wipe out the friendly bacteria, open up the doors for systemic candidiasis, and so on and so forth. So it caught my attention, and this is why I'm here talking about this now. So the next slide, we will actually see a photo of one of these devices. It's no bigger than a mobile phone. It's so simple to use. It's an on button, a run button, and a scroll button. The app, which I guess would stand for anti-parasite, is basically for microbes. So here you can eradicate parasites, bacteria, fungi, viruses, mycoplasms, and all types of microbes. There are actually over 1,500 available programs on the USB stick, which is called the Therapy 8 USB stick. When someone purchases these, they actually come with 20 pre-installed programs, but they can be programmed by utilizing the Therapy 8 stick, and particularly by the practitioner that's doing the diagnostics for the individual patient. In the next slide, we can see an example of some of the frequency programs that are pre-programmed. So when you actually get the device, it has detoxification programs: Ascaris, tapeworms, Giardia, Helicobacter pylori, Candida, Trichomonas, Chlamydia, Mycoplasma, the staph, the strep, Escherichia coli, and a whole bunch of retroviruses, which are the herpes-related family of viruses, as well as anti-inflammatory programs. There's detox programs. There's drainage programs. There are programs for detoxing the extracellular matrix, for example, so it can go quite deep into the system. It's got programs for 90 different types of viruses, 91 different types of bacteria, 61 different types of fungi, and so on and so forth. The next device is the Deta Rytme. Rytme in Russian stands for rhythm. And the Deta Rytme runs on different frequencies to the Deta app, which is for the microbes, because this is really for balancing the organ systems and the physiological systems and their pathologies in the body. Again, this has the ability of being programmed with 1,500 or more frequency programs covering the whole organ system of the body. When someone buys it, it has 13 pre-installed programs. If we look at the next slide, we will see the clinical trials that the Russians have done utilizing this device. They've been through quite a lot of disorders, such as endocrine disorders, hypertension, renal problems, gastrointestinal problems, respiratory problems, gynecological problems, ENT, and so on and so forth. If we look at the next slide, we see this is another device. It was one of their first devices. It's called the Deta Cosmo. It actually works with what they call quantum light. Light is also frequencies, and it can be absorbed by the skin, and each color has its own frequency. So this was used as a cosmetic device because it actually eliminates frequencies. It's amazing. I mean, I've tried this a number of times, where you do half the face for 15-20 minutes, and then you photograph the face, and you can see a 2-year difference between one half of the face and another half of the face. It's not permanent. It has to be repeated a number of times to really get rid of the wrinkles. But it's also an anti-aging device, because it has 13 pre-installed programs that help to optimize and balance all the physiological systems of the body. Because we know that when physiological systems like the endocrine system, the nervous system, is imbalanced, that in itself can lead to premature aging. So by balancing these, we're actually slowing down excuse me, the aging process.
Let me ask you one question, Dr. George.
Sure.
It's not permanent. Is it permanent with any of the devices in any of the things that you're treating, or do they all require repetitive use of the device over and over and over again?
No, I think it's permanent, assuming that the person is also making lifestyle changes.
Which goes back to Bill's point. Yep.
Yes, I mean, we have to look at it within a holistic model again. So if we're optimizing the person's diet, if they have all the nutrients that the body requires, if they're not smoking and doing other silly things that are creating tons of free radical damage, then yes, these are permanent. In the same way as once we remove a pathogen, unless the internal milieu of the body changes, that pathogen should not come back again.
And are all these devices, like the larger devices, diagnostic as well as therapeutic?
You have just caught the next slide, Al, as usual. Let's go to the next slide. The next slide actually is just looking at some of the advantages that these devices have. They are very easy to use. They're curing incurable, in inverted commas, diseases such as hepatitis, such as some of the viruses that we all know are really difficult. They have excellent results with treating tuberculosis as well. Big trials in big clinics in Russia. They can be used by all age groups, etc., etc. If we go to the slide after that, we will see an example of a diagnostic device. Are we having problems with the slides, Bill, or are we nearly there?
We're on slide 26, advantages of the data ALS devices.
Okay, next slide. Next slide.
Diagnostic and therapeutic.
Yep. Right, this is the top-end diagnostic device. It's actually diagnostic and therapeutic, this one. So on the left-hand side is the diagnostic, and on the right-hand side it is capable of 5 different modes of treatment: electromagnetic therapy, electroacupuncture therapy, quantum light, bioresonance, or a combination of all those. It's a very powerful device, probably the cheapest on the market. I have a whole bunch of bioresonance devices, therapy devices, etc. A lot of them are German technologies that are running into 30,000 euros, 35,000 euros. This is 8,000 euros. So it's a lot cheaper than a lot of the other devices out there, but it's also very powerful in the sense of the synergy of treatments that one can program into that. Of course, this is not a device for the average layperson. This is a device that is only bought by practitioners who, of course, need to be trained. I'm presently setting up an online course in energy medicine and bioresonance. That's where you cover all the theory, including understanding how these devices function. And then once the practitioner completes the theory, then we meet up in a venue somewhere in the world, and we do the intensive hands-on training. And that's how the system will be working. If we look at the next slide, do the devices work? Well, they've done 20 years of research. They have 117 clinical trials. They have patents in 73 countries, including America. They have been certified by the Ministry of Health in Russia, in Israel, and very soon in Germany, by next month, I believe. And they have many, many governmental awards, and also from what we hear from other sources, the president of Russia is also using this technology for optimizing their health, and he should be congratulated for actually practicing preventative medicine. If we just quickly go through the slides, I don't think we have a tremendous amount of time, but these are some of the research studies that they've done. I'm not going to go through them in detail because we don't have a lot of time, but if we flick over to the next slide, we'll actually see the results whereby all the problems that we saw in the previous slide were actually improved by 75% in only 2 or 3 days of using the devices. They use the DETA Ritme and the DETA app for the microbes. The overall general effectiveness, as the treatments continued for a longer period of time, reached an astounding 97%. If we look at the next slide, we see another gynecological survey in a large clinic. They only used the DETA app device because here they were dealing with women with pelvic inflammatory disease that had chlamydia, mycoplasmas, ureaplasmas, cytomegalovirus, herpes, and HPV. And if we flick over to the next slide, we can see that they had a 85% success in clearing all these microbes that were causing the pelvic inflammatory disease. There is no therapist, I think, because this is a very difficult problem to clear, that has this type of result. If we flick over to the next slide, this is a pediatric clinic in Ufa on the Siberian border, using again the Ritme and the app with children that had a variety of different disorders. If we go to the next slide, we'll see that there was a 93% success rate for digestive problems, because digestive problems are microbe related a lot of the times, 87% for inflammation, and an overall 91% cure rate for digestive and inflammatory problems. When they used drugs and they compared the effectiveness of drugs, the drugs were 78% effective, but of course with all the side effects, compared to the 91% effectiveness of using a harmless bioresonance therapy. Next slide. We see intestinal infections in children with, again, an 86% cure rate. They have incredible success rate with treating microbes and infections that are and the symptoms that are related to microbes. In the next slide, we're looking at male urogenital problems. This is a large study with 2,000 patients with chronic prostatitis, prostate adenomas, chronic cystitis, nephritis, and so on. They used the app and the Ritme devices, both these devices, and as we can see in the next slide, of the 2,000 patients with the chronic prostatitis, 90% were actually cured. There is another study as well that we don't have time to go into that was 4,500 sample that had a 99% success rate with prostatitis. I've clinically verified that by treating prostatitis in at least 3 patients to date. I've only been using these devices, the portable ones, for a few months, and so on and so forth. If we go to the next slide, I'm rushing a bit here. We can see again another pediatric study with 341 children, and if we go to the next slide, the results. Even with vision problems, they had a 66% improvement. With gastrointestinal problems, as we said, that was always high because we're killing off the bugs. The autonomic nervous system problems like ADHD, hyperactivity problems, etc., 97% improvement. Even musculoskeletal problems like scoliosis, I'm sure Al will be, will have his mouth open here and saying, what, with bioresonance therapy? Well, they have a 46% improvement and a 94% improvement with respiratory problems such as asthma, etc. These are impressive results, and that's what grabbed my interest. The particular thing that really interests me, if we look at the next slide, is the hepatitis issue, because hepatitis is considered incurable both by natural medicine as well as classical medicine. And in the next couple of months, I'll be traveling up to Siberia to study with the main doctor up there that has developed all the diagnostic and the therapeutic protocols using the bioresonance devices for hepatitis. And hopefully I will be able to share that knowledge with many other practitioners around the world so we can start working on this very, very difficult problem. If we go to the next slide, these are just case histories of a person here who had a really bad eczema of the hands. They used only the DETA app device for the microbes, and the diagnostics found that they had worms, Staphylococcus, Streptococcus, and Echinococcus. When these were cleared, the hands completely cleared of the eczema. No other treatments were used. In the next slide, we have a pretty bad case of psoriasis in a 56-year-old. We've slipped past that one. This is a young kid. This is a young kid, 4.5 years old, who began getting really bad eczema on the face from 3 months old. The bioresonance diagnostics found that the kid had Giardia, Staphylococcus, and Streptococcus. The DETA app was used only for clearing these microbes, and within a year, the face had completely cleared, as you can see in the right. The next one, next slide. Okay, this is the psoriasis patient, 56 years old. Did a lot of treatments before this. You can see it's really bad, scabby psoriasis. Used the DETA app and the DETA only. Was again diagnosed with having quite a lot of microbes, and in 2 months, because the left picture is March 2011, the right picture is May 2011. That's only 2 months. She had actually cleared completely because she used the device for about 4 months. If we go to the next slide. This is another case of psoriasis, 40 years old, that had cleared, again, with the use of the DETA app alone. In the next case, we have a case of onychomycosis, where we have nail fungus. It's not very clear from the slides, but there are programs that can be used on the DETA app for nail fungus, and this is a very difficult one to eradicate as well, as a lot of practitioners are aware. And after 3 months, it had completely cleared. The next slide is of a doctor who he was actually a medical doctor, had really bad case of blistered skin, terrible pruritus, itching to the point of bleeding, had seen obviously a lot of his colleagues, dermatologists, etc. And during the bioresonance diagnostics, they found masses of worms and echinococcus, and they only used the DETA app for the anti-parasite programs for clearing these, and within a short period of time, he'd completely cleared. And last, we have another case of a 20-year-old boy who used the DETA Cosmo, the one with the quantum light, for treating this bad acne that they had tried to treat over a number of years, 4 years in fact. They were looking at different practitioners. And the astounding thing is that this result that we see here had occurred in only 5 treatments of using the DETA Cosmo. I had a similar case using only the DETA Cosmo purposefully. I didn't add any other treatments because I was interested to see the results. They had actually 12 treatments. It was a 24-year-old who had been trying to clear the acne for 7 years. And we just did 12 treatments. They were literally consecutive, so within a 2-week period, they had completely cleared. So I think that's the last slide, Bill. Again, I thank everybody for listening. I hope you find it interesting, because I find the field of energy medicine and bioresonance diagnostics and therapy absolutely fascinating. I'm absolutely convinced that it's going to be 21st century medicine. We're going to see a huge growth in energy medicine in the next decade or so, with a lot more technology that we can use for helping people's health.
So, George, let me ask you a question. Are you wrapped up here pretty much?
I think we finished the presentation, Al, but I'm open to questions.
Fantastic. So at this particular point, for the listeners that have been watching this technology is available for practitioners for their own practices, or it's not really available in this country yet?
Well, it is. I mean, any practitioner that wishes to purchase the diagnostic device will have the benefit of the online training initially to really deepen their knowledge base in energy medicine and bioresonance, because a lot of practitioners out there, this is pretty new. And then I've been given the responsibility, because the Russians have excellent professors, but unfortunately they don't speak English. So of all their professors that are actually training other practitioners, none of them speak English. So having been through intensive training programs with them, they have sort of christened me as being their English-speaking trainer for the English-speaking world, which is quite a large responsibility, because the world is a big place. But with the online course that people can do at a distance, and then the ability to meet up somewhere in the world to do the the clinical training, the intensive clinical training, these practitioners should be able to come up to a level where they can begin to use bioresonance diagnostics with their clients.
And do people contact you who are interested in the machinery as well as the course? In other words, you need the machinery to take the course, am I correct?
Well, you don't have to buy the machines, the devices up front. You can take the course and just familiarize yourself with the terminology, etc. But of course, if you're serious about becoming a bioresonance practitioner, then of course you would need a device. I'm sort of a bridge between the East Russian-speaking world and the West English-speaking world, and that's why I set up like a portal. It's actually a website, which is www.deta-ellis-uk.com. It's appearing on the slide here. The deta-ellis-uk.com site has a lot of information. There's a lot of news of new developments. There will be news of the training course as soon as I've released it, hopefully in the next few weeks. And it's also a portal for actually purchasing devices online, and then we will process the order and send it out to anybody who wants anywhere in the world.
One last question about that. Is there actually a U.S. distributor that might lease the equipment, or the equipment always has to be bought?
There is no distributor anywhere else in the world apart from Russia, Cyprus, and Greece at the moment. That's it. Because the Russians, because they had the certification from the Ministry of Health for use amongst 300 million population, they were quite happy to work in their country for a number of years because it's a large population. However, other people that saw the technology and became very interested and fascinated actually persuaded them to release it into Europe. They weren't ready, however, to release into Europe because they hadn't translated anything. They hadn't, put together any sort of training in any other language apart from Russian. And so we have been busy over the last maybe 4 or 5 months actually translating a lot of the material, getting manuals together, getting courses together, and so on and so forth, preparing ourselves to be able to confront the English-speaking practitioners that want to take on the bioresonance diagnostics as well as the treatments.
Dr. George, in conversations that we've had together on this subject, you mentioned to me some information about the usefulness of these machines for helping to prioritize treatment. So I wonder if you could just say a few words about that.
Yes. The bioresonance diagnostics will basically give you answers to any question that you ask of it. It's pretty much like a computer. Whatever question you ask the computer, it will give you an answer. I mean, the computer, of course, is not intelligent, it's stupid. The bioresonance device is only resonating with whatever is in the patient in front of you. So if the patient has a bunch of different bacteria or viruses, then it will give you the answers because it will be resonating with those bacteria and viruses, and so therefore it will identify them. You can go further, of course, because you can look at organ systems. You can also look at individual organs and ask the question, is there inflammation in this organ, or is there degeneration in this organ? You can also then ask the question, how much inflammation? Is it really acute inflammation? Has the inflammation been chronic? Is the degeneration, has it just begun, or has it deepened? You can also chase, or you can look at the pathogenesis of disease by having the patient, I mean, let's go back to the prostate problem, for example. We can check the prostate. We can ask the question, is the prostate inflamed? Is it prostatitis? No. Is it adenoma of the prostate? No. Is it benign prostate hypertrophy? Yes. What is causing this? And then you can start testing a number of different microbes against the prostate. So you actually leave the prostate in one of the filters and you filter on another level one of the microbes that you're looking at. And then you draw the correlation. And then you can say, okay, is the urinary bladder affected? Is other organ systems in the pelvis affected? Is there inflammation in other organ systems? Is there heavy metals in the prostate? You can begin testing individual heavy metals. Of course, it will not give you a quantity. It's not quantitative, it's qualitative. Right. It will say yes, no, yes, there's mercury, yes, there's lead, yes, there's this, yes, there's that. Then you can ask the question, okay, there's a lot of inflammation in this person. What is causing this inflammation? Is it food intolerances? And then you can take each individual food and you can test each individual food and identify the food intolerances, which is fantastic, of course, because as we know, food intolerances cause a great deal of internal inflammation. Because the immune system produces immunoglobulins that attach with the food molecules that produce immune complexes, and that sets up a biochemical cascade of cytokinin and COX-2 production in the body. These are inflammatory chemicals. So it's a huge source because we're eating foods at least 3 times a day. So by identifying these food intolerances and removing them, we're removing a huge source of internal inflammation. Without guessing, of course, because a lot of practitioners are doing a lot of guessing here, and also medical practitioners, whereas here you're not guessing, you're asking the question and you're getting the answer. So within a holistic model, there's really nothing that you cannot trace using diagnostic, the bioresonance diagnostics.
Well, that's beautiful, Dr. George, and very exciting, and I hope everyone listening kind of caught my drift here, because what we are talking about with these bioresonance diagnostic machines is the capability of going deeper into metabolic individuality, deeper than we've ever been able to before, because we are now going to be able to, with these machines, identify the specific blocking factors and stressors, to use our terminology in metabolic typing, that are involved in the health issues of our metabolic typing clients. As it is now, we recognize that there are so many different causal factors, so many different blocking factors, so many different stressors that come into play, or could possibly come into play, in a degenerative process in a client's body. And as a result, we systematically begin to go after those. We eliminate those as best we possibly can. We go after the heavy metals, we go after the parasites, and so forth. But what we are seeing here with this new page that is being turned in our future is the ability to get much more precise with each individual and identify which of these blocking factors are involved in each client that we work with. So that vision of possibilities is extremely exciting to me, and I thank you very, very much for bringing this information to us. It really is quite interesting and very exciting.
I mean, just to give you an example of how precise one can get, let's say you've identified that there is mercury in the body. You can actually then ask the question, how deep has it penetrated the mesenchyme? Because we know that the mesenchyme is divided into different layers. We can actually ask the question, how deep has it penetrated into the mesenchyme? We can also ask the question, has it interrupted the DNA? Is it resonating, you know, at a wrong pathological frequency with the DNA, and so on and so forth? I mean, the possibilities, the diagnostic possibilities, are as creative as the human mind can get.
Fantastic. Exciting.
I have one last question, and then we'll close out the show. When you use the device for treatment, are you treating a local part of the body, or is it really a systemic treatment that actually is changing frequencies throughout, so you attach it to one end of the body and then the other? How does that actually work?
Well, if it's systemic in the sense that you're not focusing the treatment on one part of the body, but you're focusing the frequency perhaps on one part of the body. So if you're treating the liver, let's say, and you have set the frequency of a healthy liver to upregulate a sick liver, then of course only the liver will be able to absorb that frequency because it's resonating with that frequency, not other organ systems. So it's systemic in that sense, but quite focused in another sense, because every organ system and every cell, in fact, has its own individual resonant frequency.
Yes, but where are you attaching? Yeah, where are you actually attaching the device onto the person?
Well, they will either be holding electrodes if you're treating them with bioresonance, or you could be using acupuncture points to treat them through the meridians. So you'd be using a probe there, or you could be using the quantum light, or you could be using an antenna device, which is like a mobile phone, really. It's a box. Which transmits the healing electromagnetic frequencies to the body. That box, of course, can be placed on specific parts of the body. So if there is pain in the knee, you can actually place the antenna on the knee itself and put it onto the pain frequencies, because it can treat pain as well as headaches.
Fantastic.
This is 21st century medicine.
Yeah, absolutely. Another home run, Dr. George. Really tremendous.
Yeah.
Bill, I'm going to put you on the screen for a minute for your last words. I'm going to go to my screen share in the meantime.
All right. Thanks, Dr. Al. Dr. George, again, thank you so much for showing up at our MT Live. Everyone I know is going to be very, very excited with what you brought to us today. So thank you very much for coming, and we look forward to having you back in the future someday.
Certainly, whenever you like. It's my pleasure. My pleasure.